is Alice and I work as a respiratory physiologist in the NHS. One of the main parts of my job involves performing lung function tests on patients in our outpatient clinics. This consists of a few different tests to help assess various aspects of lung function, including how open the airways are, the total lung capacity, and the efficiency of gas exchange between the lungs and the blood. This video will specifically focus on this last one, what we call the gas transfer test. This test allows us to calculate how well lungs transfer oxygen from the lungs to the blood and transfer carbon dioxide from the blood to the lungs. We do this by measuring the alveolar volume, which is the surface area available for gas exchange, and the efficiency of gas exchange per unit of volume. The patient is asked to put on the nose clip and go on the machine and breathe normally. Once breathing is settled, they are asked to exhale completely and then take a really big breath in and hold it for 9 seconds. This 9 seconds gives time for gas exchange to occur in the lungs. After this, the patient is asked to exhale completely again. The machine will then analyse the gases and from this calculate the alveolar volume and the efficiency of gas exchange. As previously mentioned, this gas transfer test allows us to assess how well oxygen is being transferred from the lungs to the blood and carbon dioxide transferred from the blood to the lungs. This is important because the cells in our body require oxygen in order to release energy and function effectively and efficiently. This is achieved through aerobic respiration, whereby glucose is broken down in the presence of oxygen, and this releases energy and produces CO2 and water as byproducts. The lungs are well adapted to the role of gas exchange as they have a large surface area due to containing around 500 million alveoli, which creates a surface area roughly equivalent to the size of half a tennis court. Alveoli also have a very thin membrane which allows gases to quickly and easily diffuse through it. Finally, the alveoli are surrounded by a dense capillary network which provides a good blood supply to allow large volumes of gases to be exchanged between the lungs and the blood. However, things such as smoking can cause damage to the alveoli. For example, it can lower the alveolar volume and this decreases the surface area available for gas exchange. And we commonly see this in patients who have smoked, for example, those with chronic obstructive pulmonary disorder, also known as COPD. Scarring of the lungs can also increase membrane thickness, which reduces the efficiency of gas exchange across the membrane. Scarring can be the result of many things, such as a variety of diseases or medications, as well as a result of radiation therapy, for example, in cancer patients, or it can be idiopathic, meaning there is no known cause. All these factors can reduce gas exchange and therefore impact how much oxygen gets into the bloodstream and is delivered to cells. If the lungs are not transferring oxygen and CO2 efficiently, then the cells in the body will not receive sufficient oxygen, and this can lead to symptoms such as increased shortness of breath, increased fatigue, even with minimal physical activity, wheezing, coughing, and chest tightness. And these are all symptoms that our patients often present to our clinics with.